Hi everyone, my name is Mike Bryan and I'm happy to have Jessica Sabine, who's the Chief Marketing Officer with Kohler Healthcare, as well as Trudy Fischer, the Referral Advocate for Is Hospice. Thank you both for coming today.
Thank you.
Thanks for having us.
Yeah.
And as many of you know, we've been taking these video interviews and putting them on our website so folks have more resources available to find out about home health care, assisted living, nursing home care, as well as hospice. So that's what we're going to talk about today. And first things first, where are you located?
We're located at 601 Underwood Street here in Zanesville, Ohio. We are a home-based hospice company, so we don't have patients actually at that facility. That's just where our main office is. We see patients in the home, long-term care, and assisted living settings.
Well, and I noticed too on the website is shrivershospice.com, right?
Correct.
And I noticed there's a Facebook link, Twitter, YouTube, and there's also a contact us form on there as well. So if someone has questions, they can reach you that way.
Absolutely. Sure.
But it is the best way a phone call? Probably?
Yes.
Yeah.
And you can, we're available 24 hours a day, 7 days a week. Someone always answers our phone. And our phone number is 740-487-1241.
Okay. All right. So hospice, we talked about this before we started our video today, but hospice has that feeling that you think, oh, I don't want to call hospice. What's going to happen next?
Mm-hmm.
You have a loved one who's sick. But what is hospice really? Can you tell us what hospice means?
Hospice is a program that is set up for individuals that have terminal diagnoses. So when I say that, it doesn't mean that somebody is going to be passing away within the next week, within the next month. We've had patients we've had on hospice services for several years. And how they qualify for that service is they have to have, of course, terminal diagnosis, and a healthcare provider has to state that patient could possibly pass within the next 6 months. Doesn't mean that you're going to pass in the next 6 months, it's just you could possibly pass. A lot of people feel if they don't have cancer, they don't qualify.
Mm-hmm.
Years ago, that may have been the truth. A lot of people that would partake in hospice services were actually what we call actively passing or actively dying. Now patients can be on services for a longer period of time. As far as there's several qualifying diagnoses from COPD to CHF to kidney disease. Even some heart diseases qualify patients for hospice services. We get an order from a physician that states that the patient may pass within the next 6 months, and that's kind of how the whole process starts.
Okay.
So we'll send referral advocates out to talk to the potential patient, and the family kind of about what we provide in the home
Right.
or that long-term care or assisted living setting.
So what type of services are provided? Let's say you have the doctor's order. What's the next step after that?
Yeah, so we call them disciplines, and the disciplines is the individuals that'll come in and provide care, and that starts with our nurse practitioners that we have on staff full-time, along with nurses, aides, chaplains, and social workers. And then we have bereavement coordinator that kind of starts at the beginning of admission, and they kind of help you work through things as time goes on and conditions change. So it's a support system not only for the patient, it's a support system for everybody involved, including our staff. We build relationships with individuals, and sometimes when our patients get sick, we mourn that loss with the families. And that continues even after discharging the patient. So 12 months after that patient is discharged from our service, whether that is what we call a live discharge, that means you graduated hospice services, you've recovered and you don't need us any longer, or you pass, we're going to still stay in contact with your family members. We're going to check on them. We're going to do monthly calls. We're going to send pastors out to do visits with them if they choose that.
I did not know that it continued on like that.
Yes.
Okay, that is nice. That is nice. Well, and that kind of, I think that answers part of one of my other questions was how long do services last? I mean, it could be for a very short time depending upon their conditions, but even after someone dies, they can extend on. Okay.
Yeah, we've had patients from hours, days, months, years, weeks. I mean, it just kind of depends on patient condition.
So if they're in need of hospice services, where can those services be provided?
Anywhere that you live, you can, if you live with family members, we'll come in the home. You live in your own home environment. Assisted livings and long-term care facilities, we provide services in them areas also.
And what is your coverage area for services?
We currently cover around 7 counties. We have, of course, Miss Kingdom, Noble, Washington, Morgan, Perry. We've been up into the Licking, Newark area, Fairfield County, Guernsey, Athens. Yeah, we're a little bit of everywhere. We review all referrals regardless of location. If we can make that happen, we're going to make that happen. If not, we're going to refer to someone else that can.
So at what point, if someone realizes that hospice is a service they're going to want, how do they find out about you? When they're talking to their healthcare provider, how do they know who to go to for services?
I think it's really important for families and patients to be proactive in their own care. It's patient choice. Your provider is your choice. Just like, I know we have our DME and our pharmacies and our LTC. If you choose to buy medications at the pharmacy, at Shriver's Pharmacy, and not do it at Walmart, then that's your choice. Healthcare is the same way. Your physician might be a physician that works out of Genesis Hospital. And of course, they have their own hospice. But if you choose another provider, that is your right and your choice to do that.
Okay.
You just have to express that. Do your research. Find out what hospice companies are providing that would fit your family and your loved one.
So this sounds like, this is something someone should look at well before they need any services.
Absolutely.
Because I imagine it's just like anything else. If someone needs a lot of care, it's a little bit of a deer in the headlights feel as you're going from appointment to appointment.
Very overwhelming.
Yes.
Yeah. And so what are the ways that they can compare different hospice programs so that if they are in that situation down the road, they already know who they're going to use?
I think it's really important that you ask people in your community.
Yes.
I think that's probably the best go-to. Ask around, ask people in your church, in your neighborhood, if they heard of hospice agencies, have they known anybody that's had, a loved one in hospice care. I think that's really important because you're gonna hear what services was provided. It's just not on paper. It was actually services provided in that home.
Okay. So let's say someone, they've gone through the process of figuring out who they're going to use for hospice services. They've decided to use you. What are the next steps then? There's some paperwork they have to sign, I assume.
So we want to do all the busy work for you. So when you make that initial call to us, we asked you just a couple questions. Who your primary care physician is, date of birth, and then we kind of start working that, what we call working that referral. So we're making contact with that physician, we're expressing your interest in our services, and we're doing all that busy work for you. And, we'll come out and we'll talk about our services, what you need and what you don't need. I think it's important for people to know just because you're on hospice services, sometimes people don't need the aid service. They don't need the chaplain or they don't need the social worker, and that's perfectly fine. They're more invested in, I need the nurse to help with my medications or to monitor my pain management, my symptom management type things. So, and as time goes on, if you decide down the road, I would like to have that aide or chaplain, that is, we can fix that very quickly.
Add that on if
yes,
needed. Okay.
absolutely.
Well, and I know a question that folks always have is, okay, what is the cost going to be? How much is this, is hospice, how does that work?
The good thing about hospice services is it is a benefit that Medicaid and Medicare will pay 100%. And that's not only for the staff coming in and providing care, that's for medications that's related to whatever diagnosis we qualify you for hospice services under. That also is going to pay for any supplies you need, bed, wheelchairs, walkers. The good thing about Shrivers is we're really fortunate that, we have our own DME and our own pharmacy.
What is DME?
It's durable medical equipment. That's all of the goodies that you get as far as the hospital bed, the specialized mattress.
Sure.
We're really excited now that we have contracted with a company called Wound Pros. And this company comes in for patients that have severe wounds, and they'll come right to their home. They'll send a nurse practitioner that specializes in wounds, and they will give us recommendations on how to treat them. I think people think that once you start hospice services, it's kind of like I'm giving up. It's not. We're still treating. We don't do curative care, because there comes a point in our times when a time in everyone's life there's something we can't cure, right? But we still treat. Pain is really important, and we have to make sure that we're treating that. Wounds are painful, so we have to put the pieces together to make sure that we're doing what is best for that patient.
What are some of the other things that sets you apart from other hospice programs? We talked about a few of these things before we started today, but one of the things that really kind of opened my eyes was that you said a 72-hour time frame is the time frame for when services are requested to when they're actually required to be provided. Tell me about that.
So the guideline states that after consents to treat are signed, we have 72 hours to send a nurse to do what we call a clinical admission. The clinical admission is making sure that we have contacted our DME, getting beds and wheelchairs and walkers, the pharmacy getting medications. We don't have to do that for 72 hours after the consents are signed. We kind of put that in the back of our minds, and we want to get that admission done immediately. If someone calls for hospice services and they need hospice services, they don't need it in 72 hours. They need it immediately. And that's how we look at that with every patient. I think, we have a very good relationship with our sister company there at Kohler Healthcare as far as the durable medical equipment and the medications, where we can get them anytime we need them. If we have a medication, an antibiotic or a pain medication that we need at 2:00 in the morning, they're going to deliver that directly to that patient's home. Beds, wheelchairs, all of them items. So we're not having to wait for equipment that we need to provide excellent care to our patients.
Well, and I can't imagine it, again, if you're in need of that care, having to wait 72 hours for it. So that does sound like you've sped up that process. Now, there was there's another benefit. We talked about some bucket list experiences. Tell me about what that means.
I'll let Jess kind of take over. She's kind of the bucket list person here.
That's right. So we have the Shrivers Hospice Foundation. It was actually born out of, a patient we were working with had talked about he had always, flown in airplanes. He was a flight instructor. He trained numerous people throughout Morgan County and this surrounding area. And it just so happened that our owner had the exact same plane that he did most of his training on. And so through several conversations with the family and with his provider, we were able to kind of get him up in the airplane one last time.
Oh, that's great.
And so, the owner of our company spent about an hour and a half up in the air, flying him all over Morgan County, over his farm, over his, family home. And also about, 30 family members showed up as well, just to see that. And so we were able to, take, photography of that experience for them, which ended up being, some of their last family pictures. But, like I said, this is what the foundation was born out of. And so from that, we've been able to kind of create experiences for patients, over the last few years.
Sure.
Some bigger than others, some are smaller than others. We have baptized a patient that was like her wish for that to happen. We have also, taken patients on, overnight trips to the Hocking Hills. We've relocated a patient to Colorado to be with her family. We've taken patients on rides in muscle cars with the the convertible top down.
Sure,
Like I said, some things are smaller than others, but
Still,
yeah.
what a wonderful memory to create.
Yeah, absolutely. Absolutely. That's
Yeah.
really what we're trying to do, not just for the patient, but for the family and also for our staff. Like Trudy mentioned, one of the big things with hospice patients, is depression really sets in,
Sure.
not just with the patient, but with the family and can with our staff as well. And so one of the big things to combat depression is to have something to look forward to. And so just the experience of planning the experience is an experience in itself sometimes. And so, we're really proud of the work that we're doing with our patients and our staff and the families to be able to identify what we can do for patients. So yeah, that's something that definitely sets us apart.
That's a great program. Well, so all the things we've talked about today, I hope this gives folks a little bit better idea of what to expect from hospice. And I know that online they can view these brochures, but you have some of these available as well for folks. But if they have any more questions, they would just contact you, Trudy.
Absolutely, yes.
So yeah, reach out to Trudy if you have any more questions about hospice. But again, thanks for coming today. I appreciate your time.
Thanks for having us.
Thanks for having us.
All right, have a great day.
Thanks.